Democratic candidate Bernie Sanders has released his medical records, and they say the Vermont senator is in very good health.
Now, if elected, Sanders would be 75 years old on Inauguration Day, making him the oldest president ever. Our Nancy Cortez spoke to Sanders just a short time ago. Here's what he had to say.
Senator, I hear we're going to see your medical records today. Can you give us a little preview?
I'm in good health.
Are you the healthiest presidential candidate in the history of the world?
No, I guess that's what Mr. Trump believes he is. All I can say is, thank God, and health is something that you don't always control yourself. It has to do with genetics and everything else. When I was a kid, I was a very good long-distance runner. I ran cross country and I ran the mile pretty well. And I've been blessed with endurance, and I've been blessed with good health. And anyone who follows me around this campaign knows that we're working pretty hard at it, 15, 16 hours a day, 6, 7 days a week. So thank God my health is good. That's what the letter says.
So no red flags.
Dr. Kevin Campbell is a cardiologist and assistant professor at UNC's cardiology department. He joins us now to talk about this. So I loved how Nancy said, are you the fittest to be president, the greatest, in the best shape of president in the entire history of the world? But you looked at his results. He looks very healthy.
He really does. All his biometric data, his blood pressure, his body weight for his size, look really, really great. The chances of him developing some terrible disease in the next 4 to 8 years are really low because the man's very healthy.
So any prior medical conditions really have no play in how he is today and could be in the future?
I really don't think so. The only conditions that were released in there, that he has the gout, he has some arthritis and things like that, but really no major diseases like high blood pressure or diabetes or heart disease. I think that he is one of the healthier people that I would ever see in my office.
So let's look at some of the lab results here. He's got a total cholesterol of 196 with an LDL cholesterol of 125 and an HDL cholesterol of 46. What does that mean for those of us who are all trying to control our cholesterol?
So his total cholesterol is at target. We want you below 200. We really like your LDL cholesterol below 100, but at his age, the chances of him developing plaques in his heart arteries due to high cholesterol over the next 8 years are really slim. So I would not treat that with a drug. I would just continue to encourage healthy living and exercise.
How much of a factor do you think age is in terms of overall health?
Age is a number, and I've seen folks that are 90 years old that are really almost like 70 or 60 or 50, and I think if you eat right, you exercise, you make good lifestyle choices, and then you manage whatever medical problems you have, age is almost irrelevant now in this era of all these wonderful medical treatments we have.
So what about Governor Chris Christie? I mean, we're talking Bernie here, but Governor Christie has been criticized by some by saying, look, he doesn't look, could be a different story once you actually check him physically, but he doesn't look as if he's the healthiest guy who would ever be president. Looking back at like the old school presidents like Taft, these guys that were really large back in the day. Teddy Roosevelt, though, was a big guy. And
he also had surgery. Governor Christie also had surgery, yes.
It was the
lap band
surgery.
Yes, yeah. Obesity is one of the most common problems we have in the U.S. today. $150 billion of healthcare dollars, and I think that we all struggle with obesity and struggle to stay fit. And I do have concerns when Governor Christie is overweight and he does look like he doesn't make the best lifestyle choices in the world. That doesn't mean he can't manage that condition and be very healthy.
All right, well, it looks like he's good to go.
Yeah, he's good to go.
Dr. Kevin Campbell, thank you so much.
Thanks for having me.